Good morning, everyone. It's time to go on the record.
Opioid addiction is a healthcare issue that knows no boundaries.
The state's aggressive plan to stem opioid abuse, but will they really have the money to follow through?
We are not going to arrest or incarcerate our way out of this. This is a disease.
The Attorney General is here this morning to discuss. And
dealing with the state's opioid epidemic. Governor Baker has now weighed in. How about you?
From WCPB Boston, the inside word from Washington to Beacon Hill, today's newsmakers are going on the record.
Good morning, everyone. I'm Ed Harding, along with Janet Wu, our political reporter here at News Center 5. Thank you for joining us on OTR. Today on the record, we focus on a problem that now impacts so many families in the state. Not just people, but families. Taxes, our social health and criminal justice systems, opioid abuse. This is part of WCPB's 5 on Opioid Crisis campaign. And today we have the Attorney General of Massachusetts, Maura Healey, here with us. She is intricately involved in a new broad plan to attack the addictions. It is a major problem, isn't it,
It
Maura?
sure is.
Yeah. But first, before we start the conversation, we want to show you some numbers, some undeniable facts to give you some perspective. Federal drug enforcement agencies say opioids are the most significant drug threat in New England. In the Bay State last year, an estimated 1,000 people died from overdoses. And on average, a person addicted to opioids lives 15 years fewer than everyone else. With that backdrop, we begin our conversation this morning.
So you said this, thank you for being here on this Sunday. You said this past week you will aggressively prosecute some doctors writing opiate prescriptions. Do you think prescribers have been sort of overprotective of the system, at least at this point, at the expense of addicts?
Well, you know, here's what I think. This is a disease. We need to treat it with intervention, education, and a whole lot of treatment. We also need education for doctors and dentists and prescribers, because what's happened over the last decade or more is that we've seen this exponential rise in the prescribing of pain medication. I know from work that our office has done, there are people who are out there who are still prescribing beyond acceptable limits, or to people who may be known addicts, and that's a problem.
And the reason for that is, why did they get overprescribed?
Well, it varies from case to case, but the point here is we need to all come together on this, and that means safe prescribing methods and safe dispensing methods. I listened to a woman whose son is in recovery. She was in a car accident. She goes to the emergency room. She says to them, "I'm hurt, but don't give me those pain medications. I know what my son has been through. I know what my family has been through." But yet, she's forced to take home these pain medications. You go get a wisdom tooth removed, you don't need 30 Vicodin. So this is what we mean about being smart. The good news is we've reached out to the medical community, and they've come to the table and want to help work on safe prescribing practices.
But to the original question, have we been too lenient on the doctors? Should we have prosecuted them, or at least make a statement to them earlier on?
I think that many have missed sort of what has happened here, and it's only now when people start dying and ODing in these numbers that are just off the charts that we wake up to the realization that we've got a real problem in this country. We are less than 5% of the world's population, but we consume 80% of the world's opioid supply. 4 out of 5 of the heroin users today started with prescription pain medication. That's why we need to take action and make sure that we have safe prescribing practices in place. But it's part of a much larger picture in terms of treatment and intervention and education.
Well, let's bore down to the jail versus treatment area. And let me bring a story to it. Earlier this week, a Billerica mother and daughter were charged by using heroin in a Wendy's parking lot with there was a baby in the back seat. And they were using it, this is in Tewksbury, they were using it in a Wendy's parking lot. You said we shouldn't criminalize the users, but what should be done in a situation like that?
Well, everything is sort of case by case, and I don't know the facts of that particular matter. Certainly we need to make sure we are aggressively prosecuting drug traffickers. There are sizable amounts of heroin coming into our state, and we are doing everything in our office, and I know district attorneys and police and others in law enforcement are doing work across the state to address and deal with drug trafficking. My comment, though, is a comment about, you know, us needing to wake up to the reality of this. This is a disease that is striking every neighborhood, every family. It doesn't matter your zip code, doesn't matter how much money you made, doesn't matter how well you raised your children. It's affecting people across the state. And my point is simply that we need to effectively get out of this, and it's going to take us some time. We need education, intervention, and a lot of treatment.
Well, let me to that point, let's pick up that part of the conversation. We're talking about the war on drugs. It's now defined as the war on medicine cabinets. That's where a majority of opioid addicts say that they find their fix. In a recent federal study, 54% of addicts report that a friend or a relative actually provided them with the painkillers for free. Another 15% say they either stole the pills or bought them from someone they know. Only 4% got the drugs from a dealer or a stranger. Experts say it could be easier to deal with the pills themselves than the friends and relatives who supply them. Is this a better path, a better approach?
Well, look, I think we need to look at pharmaceutical companies and what they're doing and what they're representing in terms of the safety of the products. The responsibility is also on the public, and I give huge credit to Channel 5 for the public awareness campaign. People need to know, to the extent you have medication lying around your house, in your medicine cabinet, and you don't need it, take it to the police station. Take it to a safe disposal box, because you don't want somebody in your house misusing that, or somebody breaking into your house to misuse that. So responsibility really lies with all of us in order to deal with this effectively.
To go back to Ed's original question, so are you saying the priority should be to go after the drug traffickers and not that mother and daughter with the baby in the back seat?
Well, I don't know the circumstance of that case. Certainly, any time a
given that
child is
scenario.
involved, action needs to be taken to protect the health and well-being of that young child, and to hold people accountable for their actions. People are pumping deadly substances out onto our streets, and as a result, people are dying. Some of the heroin we're seeing is laced with fentanyl and other substances, and it's like putting a loaded gun in someone's hand. And we see the devastation and resulting ODs. I just know that we need to have a comprehensive approach, and that's why I'm all for intervention and education, more access to treatment, and yes, we need to use law enforcement tools as well.
Mass Health is really critical to making your opioid program work, considering the connector is, quite frankly, still in disarray. Do you think it's smart to rely on that system?
Well, you know, what I do think is important, that when it comes to any form of insurance, we want to identify what barriers exist in terms of accessing coverage. We've got a mental health parity law, behavioral health parity law. Substance use, substance abuse is part of that, and we need to make sure that those laws are enforced and that insurers are coming to the table and with a willingness to work to make sure that people have access to the care they need. Treating opioid disease needs to be treated, and treated mental health needs to be treated in the same way that we treat cancer, that we treat diabetes, and we just haven't done that as a society, and we need to now.
But we have to fix the mass connector before that will work, will it not?
Well, I think that certainly we need to fix the mass connector for a whole host of reasons.
We've been talking about the opioid campaign, so today's OTR Pop Quiz is rooted in that opioid campaign. Question 1, what is the name of the so-called new miracle drug that blocks opioid euphoria so addicts can't even get high even if they want to?
Yeah. Narcan or naloxone is the treatment.
A monthly injection of...
Vivitrol.
Vivitrol, which is, I can't say the word, naltrexone.
Yeah, made by a company here.
That binds human opioid receptors. Question 2, Narcan, you were just talking about, also known as naloxone, is carried by many police departments to revive people who have OD'd on opioids. Ballpark, what cost is one life-saving Narcan kit? Ballpark.
Well, this has been the focus of my attention because there's been such a disparity, everything from $40 up to $70, and our office is trying to work to get that made available more cheaply to more first responders across the state.
So the number, we'll take the answer. $75 is the average number, but in Massachusetts, one kit contains 2 doses and 2 atomizers. We continue on the record with the Attorney General. Stay with us.